Thank you guys for letting me come speak today. I really appreciate it. I want to show of hands. How many people are here for your family member and advocating for them? I know I'm not trying to be anybody so I can feel comfortable answering. Yeah. Okay. Thank you for coming. Did everyone get a packet that needs one? Okay. Awesome. All right. I wanted to give a shout out to Caitlin in the back row. Yeah, she's gonna, I'm put her on the spot. She really helped me with this presentation. So we had a guest speaker that kind of backed up last minute, so she helped me kind of put this together last minute. So you want to thank her? Yeah, thank you, Caitlin. And then I noticed a lot of people are kind of sitting in the back. It reminds me of high school. I just wanted to tell you guys that. Maybe laugh a little bit. Okay, so let's get started. So, why advocacy matters? So, healthcare systems are complex. Appointment times may be limited or rushed. Sometimes we can feel overwhelmed as the patient side of things. And advocacy improves safety, communication, and outcomes. So that's a little bit about what we're going to talk about today. So, what does healthcare advocacy do? So we want to ask questions as caregivers and stuff, and help make informed decisions, ensure wishes are respected, follow up when things aren't clear. So sometimes questions that if you don't understand medical training, you want to be an advocate for those patients. Your role is to help connect the dots as the family member. Ask questions, clarify instructions. We can prevent misunderstandings and improve care. Talk with your loved one later to make decisions. Know what they want is important. If they can't speak for themselves, we want to speak for them. Can you see me better? Sorry.
Yeah.
Okay.
Hard of hearing people have to see people's faces.
Understood.
I'm telling
Fair. And sometimes you have to call the provider, so call your doctor to ask some questions about some medication side effects. So know your loved one, their medical history and their medications, allergies, reactions to the medication, preferences, values, beliefs, what quality of life means to them. Each person that may be an individual need. You are the expert on your loved one, especially if they can't speak for themselves. Your knowledge helps providers make better decisions. Writing this information down and keeping it accessible, it's one of the most powerful advocacy tools that you will have as their speaker. So to prepare for an upcoming appointment, bring a list of questions. That's probably one of the most important things that I can't, speak for enough. So track symptoms or changes when something's going on with your loved one. Bring medication lists or pictures of bottles. Take notes or ask permission to report if needed. I will say that my personal experience with it, especially in my current role, is a lot of different doctors will order medications. So, like, let's say you're seeing a heart specialist and a lung specialist. They may write the medications. So make sure that you know the doctor that's also writing these medications. If you don't actually bring the pill bottles themselves. So it's easy to forget questions when you're in there. Happens to me all the time. I'll think, I'm going to know what I'm going to say to the doctor. Totally forget that every time I go to the doctor because I think the doctor gets me off the left field about something else. So be prepared when you go to appointments and stuff. It helps you stay focused, helps you stay confident. So remember, appointments aren't just for you, or just for you. So not just for the provider. So keep a lot of different things. Like if you have congestive heart failure, make sure you're keeping a list of weights. Diabetes, keep a list of blood sugars. Sleep patterns, falls, side effects, different things like that are really important when you go to appointments. So now remember, ask the right questions. What is the goal of the treatment when you're going? What are risk side effects? Are there alternatives? Who do we contact if something changes? If something doesn't make sense, ask again. Is it okay to say? Can you explain this differently? Understanding the plan helps you follow it correctly once you're back home. So I will say, my first day in the medical field as a nurse, I was like, what are these people saying to me? They're talking way over my head. I don't understand. So how could somebody that's not in the medical field understand some of these things? So it's really important to speak up and say, hey, I don't understand what you're saying. Can you say this slower? Can you say this a little differently? I will say, like, people like cardiologists and pulmonologists, for example, they talk like in a different language. I don't know what they're saying sometimes. So just ask if you don't understand. You're not, that's okay. That's our job, is to ask questions if we don't understand what they're saying. And then also ask for a printout of written instructions after you do see the doctor. Stay calm and respectful under communicate effectively. Repeat information back to confirm that you are understanding it. Use phrases like, help me understand. I'm concerned about. This feels different than usual. Can you explain this in more simple terms? So kind of a little bit about what we were talking about before. Like, hey, this is above me. What are you trying to say? I mean, that's not wrong. If you don't understand it, that's okay. Clear communication builds trust. So if you're emotional, that's okay. This is personal. This is your family. This is your loved one. It's so appropriate to ask for time, clarification, and reassurance. When you need to push back, request clarification one more time. Ask for a second opinion. If you don't agree with that provider's first opinion, you can ask for a second opinion. Say, I'm worried about my loved one's safety. Advocacy sometimes means being persistent, that we can feel uncomfortable, especially for caregivers who don't want to seem difficult. But protecting your loved one, that's not rude. It's being responsible. Advocacy in difficult situations. So sometimes we have a loved one that maybe has dementia, or they're cognitively declining. So those can be really difficult, especially when we start to get kind of burned out as a caregiver, because that can happen when you're with them 24/7 and maybe they're acting a little bit inappropriately, like, hitting or not being well behaved as we would like them to be, or it's kind of the end of their life. Those are very, very difficult situations that we sometimes face. Or language or cultural barriers. And then, like I said, end of life, care transitions. So when they've been in rehab for a long time, or they're coming home from the hospital, or going to rehab, or going home from rehab. These moments are emotionally heavy and often confusing. Having documentation, asking for written care plans, and involving social workers or care teams, they can reduce stress and prevent errors. So asking for forms in your primary language, if English is not your primary language, that's totally okay to do. So knowing your rights, informed consent, access to their medical records, HIPAA permissions, advanced directives, and healthcare proxies. So many caregivers don't realize that these protections exist until they're in the crisis. So until something goes wrong, we need to prepare paperwork ahead of time. So that can relieve pressure and ensure your loved ones' wishes are honored. Because you don't want to get in a situation where it's like they're in the hospital on a ventilator, my dad's situation, and then you can't do anything because you're not listed as a DPOA. So, and we'll talk a little bit later about like DPOAs and stuff, but you don't want to get in that situation and then you're like, well, sorry, we can't help you or we can't tell you anything, because that's the worst feeling in the world as a caregiver. So then we talk a little bit about self-care. So I see that every day. I get phone calls from caregivers and stuff that caregiver work, and it's exhausting because you care for that person that's really sick 24/7, and they are tired. I mean, it's going to happen. To be a 24/7 caregiver for somebody that can't care for themselves. So advocacy is exhausting, and you can't pour from an empty cup, right? I mean, there's nothing left in there. You're caring for someone that can't care for themselves. So you have to ask for help and support. And you have to rest. Sometimes we feel so guilty because we want to care for the person 24/7. But you can't care, and you're going to get sick yourself unless you take care of yourself first and foremost. So caregivers often neglect themselves. Burnout affects your health and your ability to advocate. Taking care of yourself is a part of taking care of your loved one. I cannot also say that because it happens so much. So please remember to take care of yourself. Rest, eat, sleep, even leave the house for a little bit. That's just so important. Go for a walk. Do an activity you like to do, whatever that might be. And then final encouragement. So your voice doesn't matter. You're not alone at all. Advocacy is an act of love. You are doing the best you can. And I know some days, from personal experience, it feels like it's not enough. But it really is. Everything you're doing to support and care for your loved one you're doing a great job. I mean, I feel like sometimes we don't hear that enough, but we just hear the terrible things we do. But you guys are all doing a great job caring for your caregivers. Caregiving is hard, it's emotional, and it's not often invisible work. Like you don't hear somebody patting you on the back, but you should. Advocacy does not require perfection, just presence and persistence. Your love and effort really do make a difference. Okay, so now let's go over what's in your packets, the other stuff. So the medical advocacy binder that we have, like patient information sheet. Yeah, did we not get one? Sorry.
You need one, raise your hand.
Yeah.
Take care for mom and dad, and you need a second one, let us know.
So it should, I believe your first page, sorry, I don't have one now, can't remember, but it should say caregiving, it should say the medical advocacy folder and then a practical tool to help you advocate for your loved one. Thank you. So it should talk about how caregiving is one of the most meaningful and challenging roles a person can have. And so you are the voice, the protector, and often the bridge between medical teams and your loved one. The binder is designed to help you clarify, to give you clarity, confidence, and organization, so you can advocate effectively. So you're not being alone or being difficult when you ask questions, as we've talked about earlier. You are not overreacting when you speak up. You're advocating. So take notes, ask for clarification, request written instructions. Trust your instincts. You know your loved one's best. You are doing important work. So that sums up kind of a lot of what we've talked about. But it's really, really important to take notes when you go to the doctor. You might feel overwhelmed at times. This is normal. Organization creates clarity. Clarity builds confidence. Confidence strengthens advocacy. Bring this binder to appointments. Review medications regularly. Write down questions before visits. Do not leave until you understand the plan. You are a critical part of the healthcare team. Your presence matters. Your voice matters. So that is super important that you make sure you ask questions and stuff, and make sure you understand before you leave, because maybe you're doing this for your spouse, your sister, your brother, and the medication has changed and you have no idea what they said. You thought they said take one pill, and it's actually supposed to be half a tablet. of a blood pressure medication. So make sure you're understanding that before you leave the appointment, that there's no chance that you're like, yeah, I thought it was this, and then it's not. So just make sure you really understand that before you leave. And then the first one is the patient information sheet, because maybe you think that they have a DNR and the patient has, your family member has no DNR in place. So make sure you're filling that out correctly as far as what your family member has stated to you and stuff. And then insurance information is very important. Any specialists, allergies are another one that are really important too, because maybe they are going by emergency services and they're trying to give them an antibiotic that they're allergic to. So I would just say to make sure that you understand that as well as you know. The next page, we're talking about the medications. So that is the medications. So let's say you have to go out for a little bit and somebody else is staying with your family member. This is really good to know. Like as a nurse, I love medications and love to know what somebody's taking. So always try and as accurately as you know it to be. So if they're supposed to be taking a blood pressure medication and they're supposed to take it, twice a day, just make sure that is pretty accurate as well. I know sometimes, like we just talked about, that can be changed, but you want to make sure that you kind of know what somebody is supposed to be taking. And then just as needed, if you have a Tylenol or pain medication and stuff, those are usually going to be kind of as needed. So appointment. So this is going to be if you just get out of the hospital or rehab and you're seeing a specialist. This is where you're going to write down the notes of what you maybe want to speak to that provider about. So, my husband just had a fall yesterday and, has a new bruise on his forehead. Different things like that may be something that really worth mentioning, and you're going to forget that because, you want to talk about just the recent discharge from the hospital. But, it's got that big old goose egg about his head. Surely the doctor will see that, but you'd be surprised at things that doctors miss. So just things like that are things that you just want to talk about or something. Or, his blood pressure has been very low all of a sudden, and it had been really high. So you don't want to miss these kind of things. So those are really important to write down the notes that you don't want to miss when you go see the doctor. And then I would make a note before you leave. I know doctors are always trying to rush us in, rush us out. But, if the doctor says, I want to see you in a month and we're going to change your blood pressure medicine to 2 tablets once a day, just make sure you get that, because if you're like, don't forget the minute I walk out the door. So just really important to make notes of everything. And then let's go over the symptom and daily health tracker. So this is also something you want to take with you to the doctor. Let's say that your spouse is telling you that they've been having chest pain for the last week, and they tell you every day, I'm having chest pain really bad. Hopefully we'll get checked out before we go to the doctor, but maybe not. I would make sure I make a note of different things that are occurring, and if it's abnormal, even if it's not abnormal, if it's been going on for a year, maybe it means something. I would go ahead and write that down. And what the comments are is, stabbing pain to left chest, feels like. Those are different comments and stuff. And then, or going to the bathroom. Urine smells like mud. I mean, just different things like that may be abnormal, right? So those are really important things that you can tell the doctor. Or you have home health or hospice coming in, you can tell them that too, because maybe they can tell the doctor and stuff, and get cultures and different things like that. But you don't want to wait until the last minute to get these things addressed. They're very important to get checked out. Make sure I didn't miss a back. Sorry. So on the back of that just continues on. So then, if your loved one does have a durable power of attorney, you definitely want to keep that, because maybe your doctor's office doesn't have a durable power of attorney, then you want to give them that to keep a copy of. And a lot of times you can get that notarized, or you want to get that notarized in the same way with your advanced healthcare directives living will. We all, I will tell you guys, we always ask those kind of questions and stuff. So if you don't, I highly encourage everyone to get one. Those are really important legal documents that you want. Now, there is a difference between an in-hospital and an out-of-hospital DNR. So, sure, a lot of people shake their head that they know that. So, in-hospital, obviously, in the hospital, out-of-hospital, you want to keep in your fridge. So, in your fridge, you can keep it like on your refrigerator because, let's say, my spouse, unfortunately collapses and his heart stops and stuff, but he did not want to be resuscitated. I would have that in my fridge because if I was to call EMS, they would try and resuscitate him unless he has the kind of hospital DNR. So that goes back to you want to know your loved one's wishes because honestly, I probably wouldn't be calling EMS. I would just probably call and say this is what the wishes he wanted and stuff. That's knowing what your spouse is any of your loved ones, your parents' first wishes and stuff. But you want to have that posted somewhere because if you don't have anything posted and you don't know what their wishes are, they're automatically going to assume that they're going to be a full code and go ahead and do a full resuscitation on it. So, but you have to have both. If you want to be a do not resuscitate, you need to have the in and hospital DNR. And some people just do it because they'll sign the reason you probably not have is let's say you had a surgery and you revoked your in-hospital DNR. That's a lot of times I've seen people not do that and stuff because they're like, well, I'm just going to have a simple knee surgery. If something goes wrong, then I'll go ahead and have my DNR revoked. Like I've seen weird situations where people would have their DNR revoked for in-hospital for like simple surgeries and stuff that they don't expect that. But most of the time people will keep both of them and stuff regardless of the situation. But typically, if you have one, you're going to have both. So, but some people don't realize that you have to have both to have no resuscitation outside the hospital too. So, definitely remind your loved ones that that's their plan. If they don't want to have any resuscitation, they need to have a separate one done too. Because if somebody calls 911 and their heart stops, then they're going to be resuscitated. And they might be ticked off at you if they make it through that. So, just remember that. So those are the big things with the in-out hospital DNR. I'm trying to think of anything else that I had that was super important. But I didn't take a lot of you guys' time. Well, I'm going to open up to questions for me. Yes. Can you explain the difference in code status? Yes, I can. So you can have like a limited code status to where you could be no chest compressions, but you could want ventilation and stuff. What is that called? Like, yes, they do not innovate. DNR. Like, you can innovate if you want to be receptive. Full code is doing Yep. Okay. Yeah. Yeah.
So my mom had a pacemaker placed last week, and she had to be on file at the hospital. The requirement of cardiac procedure like that was they would not do so, there's a risk. The purpose of so she rescinded it to that.
I think I've had some surgeons that have done that too, like for like a knee surgery. I think that's what I was.
Yeah, pretty common, pretty all especially. Very common. Yeah. Fires are pulling it, go into a
yes. Everybody works for a certain thing, but I don't think they want that to go against their record and stuff. So.
Yeah, so you talked about having one for the hospital and one out of hospital. When my mom was in the hospital, they took a verbal one from me because I didn't have one. And so is it better just to have the paperwork with you when you go or in hospital? And then they don't have to ask you or what? I mean, because I didn't know I had to have it.
Yes, you can definitely bring one with you if you have like an in-hospital one. I do think they're only good for so long. I think that they,
They're only good while they're in the hospital, is what I was told.
yes, and your out of hospital is 3 years, I do believe. I have to look it up and see if out of hospital is 2 or 3 years.
So just like re-signing.
Yeah, yeah, and you just have to have, because you could change your mind and say, you know, next week I want to rescind my out of hospital DNR. So, and then you just have to have a new one made, and your doctor is actually the one that signs that with you. And yeah. So,
So basically, when they asked me, do you have a DNR, I said, yes, but how old it is, ancient, so that doesn't hold out anymore, right?
no, it only is good for so many years, and I believe it's 3 years, but an out of hospital DNR is, you know, you're taking. Oh, it's indefinite, I think they expired, but I had one patient, they expired.
No, that's what the internet said.
Oh, okay. I said they had a new one, so it's expired that they don't.
I'm good thinking, I don't know.
It remains valid indefinitely until formally revoked by
Okay, see.
Different states are different.
Every state does have like a different form, because like in Kansas, for example, it's white and red writing, and in Missouri, they want it on purple. Technically, it's different. So you should have every state
Yeah,
specific. Like, not other, like I said, probably.
yeah,
Yeah, yeah, that's what it's saying, like a state specific.
yeah,
It means that you can find a state for another. That's, you know, like.
Yeah.
But it's white.
So, just look on that. A few years ago, the college church. Didn't go be that big, so they actually have a Kansas City. specific form that's- And it allows for limited. You choose to do, like, say, go innovative, whatever. Have that ability. The one thing they stipulate at home is that they advise and put it on the refrigerator.
yes.
I'm gonna be a distance.
No, you're fine.
If you ask me, but that's EMS is taught. Walk into the home. See, they don't see no refrigerator. They're,
Yeah, exactly.
10 copies of it. This is not on the DNR, but I do have copies. Now, this has to be notarized, and most banks and or libraries have it, but this is the durable power of attorney medical, and on the back is to start like the healthcare directive conversation about what your wishes are, because working in healthcare, we raise your hand if you want one of these or need one if you don't have one, but working in healthcare, we see all sorts of different things. And from the back side.
That doesn't expire.
Yeah.
Yes.
So sometimes you see different things, like Americans are different diagnoses or situations, and you don't want certain treatment. Some people, they got a dementia patient, if they reach the stage where they can't speak for themselves or background and all these things, they don't even want antibiotics. It's important to write down. Again,
Anything else, unless you guys want to make it, open it about to?
So I do have some forms that I haven't filled out about the DNR, but I thought I saw something there that the doctor has,
They do, yes, they do.
the primary care.
Yeah, usually.
You know, it's not easy to live and not easy to die.
No, I don't know.
There's no more questions, and I think next week stop by and see our sponsor and get a little treat and information. As Crystal was saying, like caregiving is important. There's a few, different people, who provide in the service caregivers, but being a program sponsor.
Thank you guys for letting me speak. I really appreciate it. It's nice to get on the office.